I'm Professor Bernd Rosenkranz, convener of Chapter 2, and together with Professor Rabie will present our project on government leadership, governance, and institutional arrangements. This on behalf of our whole team of authors listed on this slide, who have all demonstrated much dedication to this project. And I would also like to specifically mention the very efficient and valuable support by our project manager, Marie Kirsten, as well as Siran Kobo, our DPME liaison. Effective implementation of countermeasures in adversity and crisis situations, such as the COVID-19 pandemic, requires strong leadership and institutions. These have to take into account the respect for human rights. In fact, crisis situations such as this pandemic are a challenge to the strength of the society's adherence to human rights norms. In fact, the response has an impact on basic rights such as free movement and assembly, economic activity, access to food, access to institutions of learning and public service delivery. The qualitative methodology applied in this project has been similar for most chapters. This involved data gathering by different means and the use of interpretative and descriptive techniques. Specifically, all authors would like to express their gratitude to the various senior, national, provincial, and municipal officials, expert professionals, and various stakeholders that participated in the interviews that informed this research. Sections covered in our chapter are the legal framework for disaster management, timelines of events, intergovernmental relations and subnational responses, then the preliminary lessons learned, leadership and governance recommendations for a resilient disaster management system, and finally, immediate recommendations. Chapter 2 includes a presentation and discussion of timelines for key events and for measures taken in South Africa, and also some important international events before the pandemic struck South Africa in March 2020. It should be noted that the issue of pandemic preparedness was already raised before the COVID-19 crisis, which is discussed in the chapter and shown on this slide. And then I would hand over to Babette.
Thank you, Bernd, Professor Rosenkranz, for that introduction. So in terms of the findings of the report, there are some preliminary lessons that is categorized into 6 parts. And first, in terms of the quality of leadership, the report finds that South Africa was generally recognized for the quality of leadership and the fast response to the pandemic. And there was a lot of established structures that provided for an evidence-based response to the pandemic. But we also found some noticeable leadership failures and deficiencies. Predominantly, we see that there's a miscommunication between different leaders that is causing confusion in terms of the mandates and the instructions that comes through. There are different approaches to dealing with different sectors that also contribute to this confusion. There's a lack of evidence in all of the cases that explains why government made certain choices. And in the end, we conclude that while there was success in flattening the initial curve, it also may have lengthened that curve. The report recognized the immensely difficult task in balancing the need to save lives with the need to save livelihoods, but ultimately adopting a blanket approach that treated everybody in the same way may not be the most efficient way to deal with this balance. In terms of institutional capacity for disaster management, the report finds that the pandemic demonstrates that there are good institutional structures, but it also found some limitations in how these structures were mobilized. Some points to consider is the powers and functions of both the national and the provincial disaster management centers. The National Disaster Management Center in dealing with a health and a social response were perhaps not geared or previously exposed to such a nature of a pandemic, and that may have delayed the initial response to the pandemic. And we also see that at provincial level, provinces that dealt with similar disasters before or had some systems in place were generally faster to respond and easier to mobilize than in those provinces where this was not the case. So a question perhaps on what kind of structures should be put in place, what kind of capacity needs to be built to ensure that when we face similar kinds of disasters, such as a pandemic that affects everybody, how do we really respond to it in the most efficient way? There's a need for a coordinated strategy to manage the financial repercussions from the pandemic, and this spans both public, private, and civil society. In the public sector, we see that especially in local governments, in provinces, there was a significant shift in budget to deal with the human response to the pandemic, providing social assistance, providing housing to the homeless that was not provided for in the budget. And the question is, how do we deal with some of these financial repercussions on an ongoing basis? We also see that in the private sector, some response and some support were provided to sectors initially, but there's a longer term effect and recovery period that still lies ahead, specifically also as we face further waves of this pandemic. And then in terms of the civil society approach, a large debate on the provision of social assistance and the continuation, given the unemployment figures that we face, also then contributing and worsened by the pandemic. The need for a coordinated disaster response across government and also with private and non-government sectors has been emphasized through this pandemic and also found in the report. We found that there are good pockets where government with the private sector and NGOs managed to mobilize the response. The question is, how do we mobilize some of this energy and momentum to also address many of the other development challenges that we face as a society? The pandemic also showed some weaknesses in IT and data management systems, and also weaknesses in the transparent flow of information that is required for a successful response. Moving to the role and the performance of the disaster management structures, the report finds that there were high levels of institutional commitment in the structures that were put in place to coordinate the pandemic, especially in the first 2-3 months. People worked around the clock, really extremely hard to put the various components of a strategy in place and to deal with factors as they emerged. But some points to consider here, I think some of the structures that were put in place is not provided for in the Disaster Management Act, as will be discussed in Chapter 3, and this raised questions on the mandate and the legality of these structures. There's also some questions and some findings in the report that speaks to the nature of the response, which in most cases tend to be reactive to the crisis that was there at the time, instead of a proactive planning approach that tries to get ahead of a curve and try to manage the crisis that it doesn't worsen. There was a lack of transparency in the decision-making, and one of the negative consequences of that is that it undermined public trust in government to coordinate our COVID response. In terms of the healthcare sector, the pandemic showed the backlog in public health facilities and also unequal access to quality healthcare. Some points to consider here is the lack of materials, the initial lack of protective equipment, the lack of human resources to deal with the pandemic, especially when these human resources then is at most risk of also falling ill to the sickness. There was inadequate protection of the most vulnerable groups, and most disconcertingly, there was a significant decline in non-COVID patients as the hospitals and other healthcare facilities battled with managing the COVID pandemic. And the long-term effects of this is yet to be determined, but unfortunately, if people do not get treatment for underlying diseases or emergency treatment, that also has a negative effect on your population. In terms of government and society, I've already emphasized the value of the relationships that this joint response created between the private sector, the non-government sector, and the public sector. There are also some points to consider here. The initial response required rapid executive action, And under the Disaster Management Act, it bestowed certain powers to the executive, but it also undermined and compromised political oversight over these decisions at a time where the impact on human lives and ethical considerations is at its maximum. And so the question is, how do you balance democratic practice with these executive actions? I think the impact of the health crisis on society and economy was underestimated. Given the lessons learned, how do we plan better in the future for similar kind of disasters and pandemics? As the pandemic progressed, there was a general sense of lockdown fatigue, worsened by the loss of income, and this led to a decline in behavioral compliance to social distancing protocols. And I think the challenge in instilling this behavioral change was underestimated and underplanned for in the structures that was created to respond to the pandemic. In terms of corrupt practices, National Treasury relaxed procurement procedures to facilitate emergency response. And unfortunately, this resulted in some cases in a surge of corrupt practices, which undermined people's trust in government to respond to the pandemic in an ethical manner. And I think here there's a need to develop approaches that allows for emergency procurement while still retaining the necessary transparency and safeguards. Overall, the conclusions is that to establish effective disaster management, there's a requirement for well-capacitated disaster management centers to lead the response that is at different spheres of government, but also in different sectors and in different government departments, and that these are not ad hoc functions, but the really critical support functions that is actively planned for. There's a need to ensure that there's clearly legislated mandates for all actions, and perhaps to reconsider some of the legislation that one does not need to go to a Disaster Management Act to respond to health pandemics, but there may be other legal measures that is more efficient in dealing with the response that is required. There's a need in disaster management for continuous clear communication to coordinate the response. There's a significant importance in transparency and accountability in the decisions as one manages the crisis. This requires efficient data management systems that can inform quick responses. There's a need to focus on improving financial resilience in the public sector to really focus on the financial repercussions of disasters, either at a national or a provincial level, or across sectors or only within one sector. One needs to strengthen the cooperation between the government spheres, the non-public and private sectors to ensure coordinated response and coordinated financial response to such disasters. Active engagement of the public to get them to buy into the strategy and move towards successful behavioral response changes. There's a need to address the constraints in the health sector and infrastructure sectors, and really a need to establish a resilient healthcare system that is well capacitated and can respond to this crisis or others. In terms of immediate recommendations, the report finds that there's a need to reevaluate and plan for evidence-based interventions at various alert levels, perhaps moving towards a more adjustable strategy that is also based on hotspots and tailors the response depending on the crisis at the time in a particular area. We need to ensure continuity of essential health services, and that brings us again to the issue of building a resilient healthcare system that can respond to the needs of the entire population and well-capacitated and sufficient healthcare providers. There's a need to improve IT, data management and data sharing systems to have efficient sharing of information that is relevant and enables an evidence-based response to the emerging crisis. There's a need to develop systematic approaches to emergency procurement that is both flexible and transparent. There's a need to ensure effective and inclusive communication strategies within government to ensure that the same message comes across. The need to provide continued regular information to the public so that they may understand what is happening, and this can promote trust in government as well as compliance to the rules as they are changed. Consider perhaps urgent investment in essential infrastructure such as the ports to prevent the backlog that we saw in the first 2 or 3 months of lockdown, to develop a better understanding of the informal sector and the response and the support that this sector specifically requires in also to recuperate from the pandemic and from future disasters, and finally to refine the disaster preparedness plan in line with the World Health Organization specifications. Thank you very much.